So with us today is Dr. Andrea Chymiy, and she is a in, physician in Paulsbo, and she also is very active in Bainbridge Prepares, and that is the group that has been, as a nonprofit, working to respond to emergencies. A lot of work went into thinking about how we might respond to an earthquake, but it turned out that another disaster kind of hit our whole country, in fact, the whole world first. So, Dr. Chymiy, thank you very much for joining us, and I would love you to tell us a little bit about sort of what your experience has been as a physician during this really trying time.
Definitely. Well, hi, everybody. So I'm a Bainbridge resident, and I've been working as a family doctor in Paulsbo for the last 17 years. And so obviously we're all going through the same stuff together, all of us. But as a doctor in a private practice out in the community, it's definitely impacted our practice. I mean, we hear a lot about the hospitals, and definitely they've had to make huge changes in how they're doing things and really focus on providing care to the sickest patients. In the outpatient practice, it depends on your doctor's specialty, but a lot of specialties aren't even seeing patients right now because it's too high risk for them to do what they do, or they're trying to not use supplies unnecessarily. So it's tricky, right? Like I need to go see a specialist, but they told me to wait 2 months because they don't want to use resources now. But for y'all, if you do need your doctors, you can definitely reach them. Your primary care doctors are all open in some way, either by phone or by computer or in person. And it just depends on what you need to be seen about. So we're still seeing patients in our office if we really need to. And we're seeing little kids who need shots. For sick people, we see them out in their car so that they don't have to come in, and we can keep our offices as clean as possible and decrease, the risk to everybody. And everyone wears a mask when they come into our office, and everyone who works there does too. So it's definitely changed how we do things, but it's still possible to, get your medical care if needed.
And do you feel like that's happening more and more as the state starts to cope with the idea that this may be going on for a while, that we're going to need some protection measures for a while?
Yeah, I mean, I think at first nobody was sure how long we'd have to, change our operations. So I think some clinics, weren't sure how they were going to do this. But as things evolve, and it looks like this is going to take months and months, or maybe even more than a year to get back to normal. We're all trying to come up with new ways of doing things. So people that weren't set up for computer visits or these alternative types of visits are now kind of figuring out how we can offer that to our patients in all sorts of ways. The eye doctor, everyone's trying new things. The dentist, that's hard right now. But anyways, we'll all have long hair and dirty teeth by the time this is done, but it's okay.
Well, some of us started with the long hair, so we're okay, right? So I'm wondering, as this has been going on, you've also been helping out with things like response to COVID. You told me that you were involved with the Bremerton public testing, which I guess is now stopped.
Stopped for now. Right. So Bainbridge Prepares has many different facets, but part of that organization is a group I help lead called the Medical Reserve Corps. I think you met my co-leader, David Cohen, a few weeks ago.
We did.
Yeah, David's awesome. So we both kind of lead this group together, and we have recruited over 100 Bainbridge Island doctors and nurses, active and retired, to be part of our group, just to kind of be available to help out in the event of an emergency. You're right in that it was originally put together thinking more toward a big traumatic one-time event like an earthquake or a tsunami or something like that. However, that is not, we don't get to pick our emergencies. So here we are in a pandemic. So that group has been helping out with the Kitsap County testing site in Bremerton for the last 2 weeks. And that was a good experience. That was the first time we actually got to do something active since we just formed this group less than 6 months ago. And I think it went well. the county tested hundreds of people, and the good news is they didn't find that many cases. So they decided they didn't need to keep running that testing site, and that they were just going to give out all the leftover tests to local clinics and local offices so that they could test people as needed.
So do we have any concern about people who may not have a doctor or may not have medical care who might come down, or be concerned that they might come down with symptoms that would be consistent with COVID? What would somebody like that do?
Yeah, well, if somebody didn't have a primary care doctor, they could definitely go to, there's a list of different urgent cares in the county that have testing, including there's an urgent care at the doctor's clinic in Silverdale that's open every day. There's the Harrison urgent cares, but they're kind of inconvenient now. There's one in Belfair and one in Port Orchard. And then on Bainbridge, I think most people do have primary care, but they do have testing at all the primary care offices. I heard that they didn't, at least most recently, have testing at the, I forgot what they're calling the urgent care now. The one that used to be.
Right. There used to be Harrison, used to be CHI Franciscan.
Yeah.
It's called City Care or something like that.
Yeah, it keeps changing names. They did not have testing there recently, but they might get testing soon because all these tests are becoming available from the county. So we'll be updated soon.
Okay, and I'm sure there's a really wonderful website on that Bainbridge Prepares has put together using Recovers, and there's a place where if you need help, you can post a question. And I'm sure that if somebody on this call knows somebody who is concerned about testing and doesn't currently have medical coverage, you could at least start by asking a question there and somebody could get back to you.
For sure. And yeah, and the Peninsula Community Health Clinics are supposed to get some of those testing supplies from the county.
Oh, good.
So
okay,
helpful.
So that points to the fact that we have had pretty good results in terms of the last few weeks. When I looked at the report from the Kitsap Department of Public Health or Public Health District, it looked like, although we had a period there where we were getting as many as 10 positive tests a day, there have been days recently where we have had no positive tests. Now, we saw a lot of news coverage over the weekend of people who said, we're done with this. We are ready to go back to work and lift the restrictions. I wonder if you could talk a little bit about whether that's a wise idea at this point.
Well, if it were just our county that we were worried about, we could probably be reopening things soon. Because we are so closely intertwined with all the counties around us that have had a lot more cases, we are doing much better for the world if we all wait until we're all together and able to reopen together. If Kitsap County were an island, that would be different. But yeah,
you mean an island without ferry service that doesn't go to Seattle?
If it were really an island, but Kitsap is not.
Right.
And open town by town. So yeah, in Kitsap we have definitely, it sounds like, peaked and are going down, and we've had decreasing cases for more than 14 days. So technically we would qualify on some things. But Pierce County got hit really hard. King County obviously got hit really hard, and it's a lot that goes into the decision making. So yeah, and a lot of people work here don't necessarily live here. So think about people coming to the shipyard and coming to the base. Yeah.
Right, people move around. That's the nature of, and many people on Bainbridge have been travelers, so they go all over the world and then they come back. So all those commuters. So when we look at that, and we think about how the next year might look, you were saying something about it's going to be a while some of these protective measures continue. And can you talk a little bit about how that might work? Maybe not when, but how?
Right, exactly. So we probably all heard a little bit about this, but we can't go right from where we were. We can't go directly back to where we were when these restrictions started. If suddenly everyone who worked at Amazon and Google and Facebook got to commute on the ferry tomorrow to downtown Seattle, that would be an influx of thousands and thousands of people suddenly. So they're going to have to phase things in. And I'm so glad I'm not in charge of that, because it sounds very complex. But I can imagine situations where they'll tell us, okay, now you can go out as you need to, but always wear a mask if you're out in a building. And when you're in a building, you can't be with more than 10 people in the room. So that's going to enable some employers to reopen completely, and others, you can imagine, that's going to be pretty restrictive. The grocery store is always an outlier because more than 10 people will be there, but things like community theater and sports teams and all these amazing arts offerings that we are used to in Bainbridge are going to feel that slow release of the restrictions. It's going to take some planning, sounds like. And then maybe after 10 people, we'll be allowed to have 20 and then 50 and eventually 100. Who knows how long that will take.
Right, and we're waiting for some other things like the idea of being able to, ideally have a vaccine or be able to tell when people have immunity and
Right.
have some sense of how long that immunity might last. Are there any things that you could say about those various?
Well, ideally, it would be an instant test, like strep throat test, tell you, do you have it or not? That's my dream. There is a test being spoken of that supposedly is going to be able to give you very quick results. We called that company and we were on hold for a really long time. And then they told us it was going to the hospitals first. So it'll be a while till we get that in our community. But that'll be fantastic because as soon as you get symptoms, you can find out right away instead of waiting days and days. And that will help determine who needs to be at home, waiting a week or two to get better, and who around them needs to be quarantined. It'll be so helpful. So we need that capability, like quick testing, and then quick ability to contact trace. So figure out who else that person was around before they got diagnosed. That will help shut things down as soon as they start. And that's how we can continue to function.
So when you talk about having a group of 10 people, no more than 10 people meeting, that allows us to have some idea of, okay, how many people did you have contact with in the last, week?
Right. So for example, I myself was sick with something about 6 weeks ago and I had a fever for a few days. So I self-quarantined myself, got tested. It turned out fine. But during that quarantine, I wrote down how many people I'd been around because this was right in the beginning. And I'd been around on one day, 140 people between all the different, it was a day I had a lot of meetings and I had a rowing practice and then I went to work and saw 20 patients. It was horrifying. So I'm really glad I was negative.
So if anybody has any questions for Dr. Chymiy, you can either type them in the chat box, which is in the upper right-hand corner, or you can open your microphone and ask at any point here.
I've got a question. This is Chuck Hottinger. What are the estimates on the false negative rates with these tests?
Yeah, so it's not sure, but and there's a lot of different tests right now, but we're hearing estimates anywhere from 15 to 30% false negative. So we're being told if we're worried that somebody has it, that you treat them like they have it, and then you can test them again. But even some patients that I've been really worried about have tested negative twice. So it's tricky. We just tell them to stay home until they're better. 3 more days after your symptoms resolve, and then you can come back in the world. There's somebody like if they hear they're negative and they just think they can do whatever they want, and that's not ideal.
That's a lot less than the positive rates we're seeing from these tests.
Yeah.
5% positive.
Well, yeah. Well, 5% positive. I don't even know. It makes my statistics brain hurt. But if it's, we really don't know the true incidence and the true rate.
Right.
And a lot of these tests were rushed to market.
Yeah.
So haven't really been tested thoroughly.
Yeah.
It's tricky.
So it means in many ways that we're operating blind about what's actually out there. We don't really have a good sense. We just know to be cautious, and we know what's showing up in the hospitals.
Correct. And even if someone, like for instance, our police officer who passed away, which is horribly sad, it sounds like he didn't test positive, or we would have heard. But we can still assume that it's most likely he had it, because the symptoms were so classic, and it's hard to understand how else someone that young could get pneumonia and pass away. So they're doing the same thing in New York. They just added a bunch of people to their death tally in New York City because they had so many people die in nursing homes without being tested. And there's not really a much other explanation for what happened there. besides-
So let's talk a little bit about what we can do to be protective. You know, we've been told over and over again to wash our hands. That doesn't go away, right? That's really effective.
we should probably
Doctor-
do that always.
Yeah. I was thinking, I was talking to my daughter and I said, your kids or my great grandkids are going to wonder why I'm so persistently annoying about getting them to wash their hands. They won't know where that came from.
Yeah. Or the kids will watch out for us. They're pretty bossy.
And then there are questions about masks and where you need to wear them and where it's wise to wear them. You mentioned that there are often more than 10 people in the grocery store. Maybe that's why that's a good place to be wearing something over your face in addition to washing your hands and keeping 6 feet away.
Definitely. I mean, we're still learning more and more all the time. And when they first started talking about this, what they told us to do is a little different than now. So the masks advice has shifted quite a bit. But from what we're seeing across the world, masks, it's better to wear them than not, especially indoors, right? If you're outside and you're far away from people, you're not going to hurt anybody. But yeah, in any situation where you're going to be 6 feet indoors near people, I would still wear a mask. It's just not worth it. You hear these crazy stories like that choir up north in Mount Vernon that just was too scary to think about. Just, we don't want to accidentally infect our neighbors, even at Costco. It's a big place, not big enough.
I had a question about that choir. Is there any follow-on? Initially, there were 2 had died. Have you heard anything more about what the mortality rate has been?
I think they had a total of 3 deaths, but that was 60 people at that practice. Yeah.
Yeah.
And that's pretty high. Especially, it was most surprising just the number of people that were diagnosed. I think it was 45 of the 60.
Yes.
So
Okay.
that really brought it home. Like, we can't just space out our chairs and hope for the best, you know.
Yeah, and in a place like the senior center, we are thinking a lot about that, thinking about the right way that we can start to resume things. We're doing this meeting every day online. We have a French group that's meeting online and a Spanish group. And so we're all learning computer etiquette as we go. And you know, we were really looking forward to having a talent show where we get 80 people crammed into this Chymiy Hall here and have a blast performing for each other. And it looks like that's going to be a while off.
Right, I know.
So we need to find other ways to make those connections. Have you yourself found ways to keep in touch with the people that are close to you that you can't see right now?
You know, I mean, we're all kind of learning the same thing. I'm happy when my family members have the same phone that I do, so we can do the FaceTime. We did like an Easter family Zoom, you know, just like kind of like this, and got to see the grandkids and the parents, you know, that was great. Yeah, I mean, aside from that, it's just like our neighborhoods become our world's small, you know. So yeah, we'll go for across the street walks with some neighbors, things like that. We'll just stay on our side and wave and yell across the street. But yeah, mostly it's just a lot of an email and keeping in touch. I think it's actually nice because people are really reaching out to each other because it's sort of lonely being at home without much interaction in person. But I think that's bringing a lot of people back in touch, right? We need each other.
You're going to also say we've got the oatmeal club now, men's oatmeal club meeting online. We've had 2 online meetings, Zoom, and we're almost up to the usual number that we typically had meeting in person.
Wow.
Yes, we used to have a regular meeting on Monday mornings, and we would get about as many people as we have on this call at those meetings.
That's great. It must be hard though for some of the people who don't have the tech savvy. It's great that you have some help from them to get set up.
Yeah, we do. If anybody has a question or knows somebody who would like to get on this call, there are volunteers who have offered to talk them through what they might be able to do. The minimum you can always do, as some of us are doing, is get on a phone call, and you can then still hear. If you have a question and you're on a phone and you tried to talk and you can't, push the star sign and 6 on your phone, and then it will unmute you. I have to mute people so that we can hear Dr. Chymiy when she's talking. Otherwise, we get a lot of background noise. So, are there any other questions?
Yes, this is Richard Herzog.
Yes,
I'd like-
Richard.
I'd like to revisit the issue of masks. We all understand that they are just one little part of the big picture. And we understand what the major focuses should be. But I'm concerned about making or purchasing the best possible mask, considering that the incremental time or cost is not going to be great. When I go online, I now see that you can have a mask made from a bandana alone, or you can add a coffee filter, or you can add a HEPA filter, or a variety of other things. So for now, my major concern is selecting which of the best rapid handmade no-sew masks to go with. Can you suggest a way to evaluate those effectively, or in fact, has somebody come out with a definitive direction to go?
That's a good question. So we're all kind of learning as we go on this, but I have some studies recently published. I'll see if I can find it while we're talking about the different materials' effectiveness for blocking viruses. And I'm sorry, I don't have it right in front of me, but from what I recall, it ranges from a high of like 95 to 97% for those fancy N95 masks that the doctors are wearing, down to about 50% for things like a bandana. So 50% is better than zero, and it's worth wearing if you have nothing else, but it's obviously a lot less effective than these medical masks. So, and then in between there's a bunch of other materials that have a little bit more effectiveness on up the scale.
And we have some dental masks type